welcome. You're watching Medically Speaking. This is a time of a pandemic, a time when everyone is worried about the third wave. The second wave is over. But what about those who are suffering from long-term COVID effect? It's a very stressful time for anyone, all of us, as it is, but for those who have underlying neurological conditions, those who are suffering from some brain fog post-COVID, what about them? What should they do? Should they get vaccinated or not? What are the symptoms they should watch out for? Should they continue with their physiotherapy, with their medication, with their hospital visits or not, and more? That's what we will be discussing in the next half an hour. To discuss the same with me, I have a panel of experts. I'd like to welcome them all. We have Dr. J.D. Mukherjee. He is the director of neurology at the Max Hospital. We also have Dr. Rajneesh Kumar. He is a senior consultant and of neurology. This is from the Paras Hospital. He was earlier with Fortis Hospital. He also has an NGO and is helping epilepsy patients. We have Dr. Ranjan. He is a senior consultant in Apollo. We'll be very shortly joined by Dr. Padma also, Dr. M.V. Padma, Professor Padma Radha, and she is the head of neurology department of the All India Institute of Medical Science. I welcome you all, doctors. My very first question, and I'd like to start with Dr. Mukherjee. What about someone who has recovered from COVID and perhaps feels extremely fatigued, has a loss of, memory, doesn't feel like doing their daily chores? Is it possible that they're suffering from brain fog? First of all, in layman's term, what exactly is brain fog, and can COVID trigger it to begin with?
Thank you very much for giving me an opportunity to share my thoughts in this Augusta forum. So first of all, I would like to start with that brain fog is not a disease or a disorder well known. It's not a very well-defined condition, but it's a conglomeration of symptoms that include general feeling of fatigue, cognitive inefficiencies like inability to concentrate, inability to focus, the customary speed of clarity of thoughts when doing a cognitive function. So it's like, somebody who has got an alcohol withdrawal or an alcohol overflow or jet lag, confused, to work fast, not able to concentrate. That combination of symptoms is what is called as brain fog. It's a general term and it's not a specific disease. What has been noticed is that a lot of post-COVID status, a lot of patients suffer from this. Now, there can be various reasons for this that we can discuss as we go on, but this is the broad outline definition of what is brain fog. Now, the major symptom of this is basically not able to think properly, not able to concentrate, not able to focus, not able to type, not able to do things the speed with which we were accustomed to. Let me put it at that.
So, you're telling us not able to focus, not able to, sleep, but this can also look to someone, a layman, like a symptom of perhaps anxiety post-COVID, maybe depression post-COVID. How are they to even recognize these symptoms? That's the first question which comes to my mind. And what are they supposed to do next? Should they visit a neurologist? Should they go to a hospital? What should they possibly do?
So when anyone has these problems, they should definitely consult their doctor. They don't have to rush to a neurologist. They can consult their doctor, and the doctor can clinically examine them and see if these symptoms require a neurologist view. Does it require a CT scan or an MRI or any other blood test? So I'm sure any doctor would be able to adjudicate that this requires this investigations or not investigations. You're right. There will be a lot of overlap of anxiety, depression, confusion, dementia. All these features, there will be an overlay and overlap of these symptoms in a patient with brain fog. So each needs to be ruled out. Now, as you know, in COVID, you can have encephalitic picture, you can have strokes. Yes. So all this needs to be excluded before we call it as a brain fog.
But let us break it all down in simple language, in layman's term. And that's where perhaps, Dr. Ranjan, you could come in, sir, help us understand really, how does COVID to begin with affect the brain? In layman's term, how are people to understand that to begin with?
Brain fog is basically quite a vague term. right from, as you rightly said, right from these patients of COVID having anxiety to depression to the other extreme, that they are confused, they have memory disturbances, they are unable to concentrate, they are restless, they don't get sleep. So this, what I would call then, a patient has a brain fog. So the two things which is very important as far as I'm concerned. In my own practice, I find that the brain fog phenomena is more common in the elderly than the younger individuals. That's number one. You got to make sure whether your patient already did not have an underlying memory disturbance or he did not have underlying dementia, which has now become precipitated in the post-COVID period, which we are using the word as post-fog syndrome. So there was a study which was being done in NIMHANS. When I asked him the same question, has anybody evaluated these patients for their pre-existing memory status and then these patients developing brain fog? That's number one. The second part is, what I've seen very often is that people who we say have got brain fog, they are under a number of drugs. So sometimes you really don't know whether these drugs itself is causing their confusion. Now, a small example, there is an anti-epileptic which is called levetiracetam. If the patient by any chance had seizures in the period of his COVID, he's on this drug, they very often develop higher mental function disturbances. I had two such patients who were on this drug, and what I did only was to stop the drug, and they were out of the brain fog. So I think brain fog needs to be looked in a bigger perspective, in a totality of what are you dealing with. For a patient, everything is a memory loss. It is for us to judge whether he has depression, whether he has anxiety, whether he has confusion, whether he has memory loss.
Right. Let me also, bring in Dr. Ranjan at this point of time. So we're specifically talking about brain fog, and then, of course, we'll go to other neurological disorders. Stroke, of course, as was pointed out by Dr. Mukherjee, another, very commonly we had seen happening in COVID patients. But really, how long does these COVID-related neurological symptoms, and if we talk specifically of brain fog, how long does it last? Can it have a lifelong or a long-lasting effect, or is there something which patients can do to manage the same? Dr. Ranjan, over to you, sir.
It's for me.
Sorry. I will now let's actually bring in Dr. Kumar. Dr. Kumar, over to you, sir.
As Dr. Ranjan specified, you have a number of causes of brain fog. So we need to look at, what is the reason behind it, and then we need to work up. Many of the cases may be, because of depression, anxieties, fatigability, which is happening because of the disease. So you need to basically help the patient in the sense we need to motivate them a little bit, like doing aerobic exercises. It has been seen, it's a very good way to really help the patients. You can start with small exercises of 5 to 10 minutes duration. Slowly, you need to increase it. And as you increase, you'll find that, because the exercises also helps in your memory and retentions. So that's going to help us in these conditions. And the best way to doing is with about 30 minutes of exercises, 5 times a week. If you start and you slowly do those things, you find that the person slowly starts to come up in his normal self. People have seen, diet is very much important. Diets which are rich in, antioxidants, fruits, normal vegetables. Diets are very, very important. Nuts, so they can help us out in coming out of these conditions. Thirdly, people have seen that, socializing helps out a lot, because all these period we have been, living in our own selves. Interactions have been less. It's only been digital interactions. So as much as the social interactions increases, a number of persons would recover in this condition, because that also gives a comfort to our living. People have
Right.
seen that, sleep is very important, because if you have a good sleep, that also helps out, because good sleep is something which is helping our body systems, immune systems to come up. And that is another way it is going to help in this condition. So it's basically an overall conditions that we need to assess and we treat it accordingly.
When you have COVID, you're completely isolated. For children, it's furthermore difficult. For parents, they have to take care of children who aren't going outdoors at all. Elderly, everyone completely locked up in the house, no social life. Also, if you get COVID, there is, at least back in the second wave, there was a high fear of morbidity, reports coming in of no beds availability. How is a person to manage their brain health in a situation
I
like
would
that?
again say that the brain fog in the elderly would ideally be different from a situation in the children. Why I say that?
Mm-hmm.
Because in children, what may be interpreted as a brain fog could be anxiety, depression, staying in the house, irritability, lack of concentration, lack of adjustment. Child for 6 months in the house, how long can he keep on doing online classes?
Right. But okay, I focused a lot on brain fog because that was more in the news. That's something which was bothering a lot of laymen. But let's talk about other neurological diseases also. And since we are focusing, and you just spoke about the elderly, Dr. Kumar, please come in here, sir. A lot of elderly have Parkinson's disease, they have Alzheimer's. How are they to take care of themselves? What happens if they get COVID? And what is a general, a care or a tip you would like to give a caregiver who's taking care of an elderly, perhaps who has a Parkinson's disease, Alzheimer's, or, other such severe neurological issues?
Because if you see Parkinson's or you see Alzheimer's, we know that the caregivers are also too much stressed out. They have to look into the things, they cannot express it. Especially in Alzheimer's people, they do not have any insight, so it becomes a very big problem to really support them. You had number of some small groups also, that the patients would come in the morning, would meet, and then they would go off. So they were earlier in this pre-COVID area, you had those type of facilities, small facilities were there, but they were also closed down during this period of time. So we found, I found out, many of my patients, they suffered a lot, and the caregiver also suffered a lot. I had number of my caregivers who had a migraine increased, who had headaches, who had tension headaches had increased. So the caregivers were also having a lot of problem. So what we did it from our hospital, we used to have a small Zoom meeting of the caregivers that we were doing it out. If we could hear with the patients, we were trying to do those out, because the more you talk about, if they can express the things, you can really give us small directions. That helps out a lot in this condition, because medications, we do not have a lot of medication. We do not need to change a lot of medications, but you need to have a support which is very, very essential.
But can they or should they continue medication, Dr. Mukherjee? Patients perhaps are suffering from neurological diseases. Are there any medication which they should stop? Because there were earlier reports that stroke medications may not go well with COVID medication. What should such patients do? Should they continue with their normal medication over and above, the COVID steroids or other medicines which they may be consuming?
So that's a very pertinent question that you have asked. So one, let me answer it in subgroups. Supposing somebody has a pre-existing medication, for example, for epilepsy, or for Parkinson's disease, or for myasthenia gravis, they should continue with those medicines. What happens is, because the level of care drops, particularly if it's an isolated ward or isolated at home, the level of care drops tremendously, and patients are lost out on these medications. So all efforts must be done to continue with the medications. Coming to your specific question about stroke and COVID, that we have to see what is the type of stroke that is. It's a hemorrhagic stroke, we can't continue with the aspirin that we were giving earlier, and vice versa. If there is an hemorrhage due to some other reasons, again, we can't give aspirin. But if it's an ischemic stroke, I don't see any reason why we cannot continue with the medication. We may sometimes have to increase the dosage of medication. For example, somebody has got myasthenia gravis and there is a respiratory worsening, then we have to increase the dosage. Certain patients require scaling up the steroid doses. Some patients require scaling up the required medicines for Parkinson's. So every patient will be dealt with differently. There cannot be one rule for it, but the general principle is continue with the treatment that you were having pre-COVID, and if required, the dosage can be adjusted, escalated, scaled down depending on the response of the drug to the patient has.
But Dr. Mukherjee, one of my final questions to you: are there any neurological condition which itself can get triggered due to COVID? Could you elaborate on that a little bit, shed some light on the same?
So as we have already discussed, all neurological conditions can get exacerbated during COVID, post-COVID, they are well known, right? Because of the stress and strain and because of the peculiar situations and the peculiar pathophysiology which happens in COVID. For example, strokes can happen again in a person who's already had strokes. Parkinsonism can worsen, A, because of the direct effect of the disease or because of the lack of medication. Myasthenia gravis is one of them which has worsened, which can cause respiratory failure. So all these conditions, and you can have Guillain-Barré syndrome, which is well known. So following COVID infection. So all of this, all neurological conditions can worsen following COVID.
Right, they can worsen, sir, but those who already have these conditions, are they more susceptible to catching COVID? Is there a correlation?
There's no direct correlation. The work is still going on. A lot of studies have come up, but I cannot give you a direct correlation. But yes, they are very vulnerable and it can worsen. That's the general message that we would like to give.
All right, Dr. Ranjan. All right, Dr. Ranjan, my last question to you. What about inoculation, vaccination? Should, people who have neurological conditions, should they refrain from getting vaccinated? Or should they just go ahead and get vaccinated at the first, perhaps as they are more susceptible any which way to catching COVID?
Well, thank you very much. I'm asked this question at least 10 times in a day on my telephone or the WhatsApp message. Believe me, I do not, I tell everybody to have the vaccine. There are only in some situations where I'm slightly scared, to be very honest with you. I'm not scared in stroke. I'm not scared in Parkinson's. I'm not scared in dementia. I'm only scared in drugs which are immune modulated illnesses, like multiple sclerosis, Guillain-Barré. These are immune mediated diseases. I'm not too sure, nobody in the world is sure, whether the vaccine is safe in this condition.
So what do they do in that case?
I honestly tell them, avoid if you can't take it, avoid taking a vaccine. In no other situation, I tell my patient not to take a vaccine.
Would you agree, Dr. Kumar?
Yeah, it's the, I also tell my patient, most of the patients, I tell them, you need to take those things. It's only.
What about multiple sclerosis, etc.? Do you tell them to avoid
it depends. It depends upon what of the disease modulating drugs they are on. So I decide upon those things, one which are immune mediating ones, and they are a little bit more potential. So in those, I am a little bit skeptical, but rest I would like to give in all the patients. I tell them to take it as soon as possible.
All right. Dr. Mukherjee, I'm going to give you the last word as we close this debate. What will be your message to those perhaps who are already suffering from neurological, disorders at this difficult time? Third wave, many say impending, many experts say already here, some say coming in a week, a month or so. What will be your message to them at the end?
Get scared, get vaccinated unless you're specifically told not to get vaccinated. Most of the neurological conditions, particularly the brain fog where we started, is self-limited and becomes all right. So let us be positive about it. This is not a very bad condition. Most of the cases have recovered very well, but get vaccinated. Majority of the patients should get vaccinated, except there's a clear exception to that, which are very, very far in.
All right. The majority of patients do get vaccinated. Best to, of course, continue your medication. Be in touch with your doctors, continue your video consultations, continue your physiotherapy, but at the same time, take all precautions. Thank you, all of you, for joining us on this panel. Rather riveting conversation. I really hope all our viewers, it's been helpful to you. Stay safe, stay indoors. Thank you for watching.
Thank you very much.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.